Hi, I'm Dr. Chris Salvino from Phoenix, Arizona. I'm a surgeon. I'm interviewing Dr. Santamaria. We're here to talk about healthcare. Dr. Santamaria has been practicing medicine for approximately 50 years and has an interesting and unique perspective on healthcare. Welcome.
Thank you. Nice to be here.
Let's talk about defensive medicine and malpractice. To me, there's 6 parts to malpractice issues. There's the premiums physicians pay for malpractice. Then there's the premiums hospitals pay. Then there's the premiums companies like pharmaceutical companies pay. Then there is defensive medicine, which we're going to talk about in a second, for doctors, for hospitals, and for pharmaceutical companies. So that kind of puts malpractice in perspective. It's not just about the insurance we pay. Would you say that's a pretty correct statement?
Yes. Just an example of this, when I first started 40 years ago, if I see a patient with possible appendicitis, all we have to do is do a physical examination, a chest x-ray, EKG, and blood chemistry, and that's all. And then we take them to surgery. Nowadays, before we can take them to surgery, we have to do all this expensive blood work, all this CT scan, all this defensive medicine. When we know that the patient has acute appendicitis from the very beginning, but I have to do it because that is the standard of care right now.
And not to bash Washington, but some people in Washington, possibly Barack Obama, would even say that by doing an appendix operation, are we doing that just to make money, or are we doing that for patient care?
Oh, no, I'm a physician. I'm not doing this for the money part of it. I just love my profession, and I love to help people.
What do you think the number 1 or 2 major problems with the healthcare system in the U.S. is right now?
Well, I think there are too many regulations, too many politicians getting into our business, too many lawyers that drive the insurance company high. And it's not a pleasure to practice medicine now because you're afraid that you may get sued. And I don't want that kind of practice.
As we now know that the percent of our gross national product is 17% being spent on health care. Just about a decade or so, it was 6 or 7%, and it's predicted to be almost 30% in 10 or 15 years. So the gross national product spent on health care is out of control. Do you think that the health care reform in Congress that's being proposed right now, and I know presently during this interview we don't know exactly the final form, but do you suspect that it's going to actually lower the gross national product?
Oh, I don't think so. I think it's going to be very expensive, especially if it's run by the government. The government has what do you call that? They were not very successful with Medicare or Medicaid, and everything they touch, they just are not good at solving a problem. They are very expensive, and I think it's going to drive the cost of medicine higher.
You're a world traveler from a healthcare doctor point of view. As you mentioned, you've been to 5 other countries. Would you prefer to practice in the American system the way it is right now, or a socialized system such as Canada or Europe, or part of Mexico is actually socialized? So which would you prefer to work in?
Well, like I said before, I mentioned I do volunteer work with all those third world countries, but I've been to England and Canada. I have English physician as a friend that train with me, that I still communicate with them. There's one in Canada that I just went in a volunteer medical mission, and we have been talking about this. And this is not coming from me. This is coming from those physicians from Canada and in England. And they don't like what they have there. So I think the United States has the best healthcare system in the world.
I want to thank you for spending time talking about your perspective on 50 years of healthcare. It's been eye-opening, and I think more people should listen to people who have been around for a number of years. There's a lot to learn from that, so thank you for your time.
It's a pleasure to be here. Thank you.